Hello, everyone. My name is Dr. Jinnah, and I am a professor in the departments of neurology, human genetics, and pediatrics at the Emory University School of Medicine. I've been asked to give a brief summary of tremor. I see patients with tremor in my clinic all the time, and we have some interesting research, clinical trials that are beginning now for tremor, and I wanted to tell you a little bit about those as well. So with that brief introduction, I'll just jump right into my summary of tremor. And I usually start by telling people that there are two main types of tremor, which are shown in this slide here. There's the Parkinson's disease tremor, and then there's something we call essential tremor, which I think many of you may have. And these are the most common types, and we need to discriminate them because they're treated very differently. And the discrimination of these kinds of tremor is made by looking at these aspects that you see over here. So we typically ask what body part is affected. For Parkinson's, it's usually one side, while for essential tremor, it's usually both, although one side may be a little bit worse than the other. We also discriminate them by asking when does it occur. In Parkinson's, it typically occurs when the arms are relaxed, not when they're using them. And in essential tremors, it typically occurs when you're using your arms. Maybe you're just holding them out in front of you, or you're holding a cup of coffee or trying to write, and then the tremor is bad. The other thing that helps to discriminate these two kinds of tremors is whether other movements are slowed down. And in Parkinson's, we have patients who complain a lot that their movements are getting very slow. But in essential tremor, we don't usually have this so much, maybe a little bit, but not a whole lot. Parkinson's patients often complain that in addition to tremor, their muscles feel stiff. And in essential tremor, they might have it a little bit, but it's usually not a big problem. Balance problems can be seen in both, but they tend to be much more severe in Parkinson's tremor. And then one of the important issues here is, does the tremor get worse over time? And as many as you know already, both types of tremors get worse over time, but Parkinson's tremor tends to get worse much more quickly over a period of a couple of years, really, maybe 6 months or 2 years. Whereas essential tremors, we often find people have had them for many years, sometimes 5, 10, or 20 years, and they're still progressing very slowly. So these are the clinical characteristics that we use to separate the two main types of tremor we see in people. And I'm going to focus mainly on essential tremor because I believe that's what your group is mostly interested in. So one of the big questions I get in my clinic all the time from most people is, well, what is the cause of this? Why did this happen to me? And the honest answer is we don't really know. There's a lot of research going on to try and find out what the cause of tremor might be, but we still, at the moment, we don't really know. We think the problem is in the brain, and in particular, the way the brain is sending signals to your arms and legs, and this makes them shake. And there's lots of research going on in trying to figure out what's going on in the brain to cause these tremors. And we know a little bit, but we don't really know all of it. The main region that we often think about is shown over in this diagram here. It's this blue round area. We call it the cerebellum and its connections. That's the region that seems to be the culprit in causing tremor in a lot of people with essential tremor. Exactly what it's doing to cause tremor and why it's doing that, we don't know, but there are many of studies going on now to try and figure it out. Typically, if we scan the brain in people with tremors, the brain looks fine. If we look more carefully about physiological recordings, it's hard to see a major problem. So whatever it is, it's something to do with the way this region communicates with the rest of the brain and with your arms and legs that seems to be the problem. Now, the other thing that we know about the cause is we suspect inheritance, meaning that there's a gene that may have been involved in causing tremor. And the reason we suspect that is because about half of all people have at least one family member affected, and some of them have lots of family members. Okay, so how do we treat essential tremors? Many of you probably know this already. I will just review what we usually summarize in terms of the treatment. There are two main oral medications used to treat tremors, essential tremors. They are propranolol and primidone. And I wrote over here that they work just okay. They are not miracle drugs. They actually do help a lot of people, but they have a lot of side effects and they don't really suppress the tremor 100%. So we have other things we need to do. These tremors are good, but they're probably not good enough, and you probably already know that. There are lots of other medications that are sometimes used for essential tremor, but they work even less well than propranolol and primidone. Some of the names you may have heard about are topiramate, gabapentin, and several others. Whether or not you try these is a matter of personal preference and doctor preference. Some doctors say, no, these don't work well enough. And if these two are not working, I'm not going to try these because they just are not as good. They also have side effects too. So if they're not really doing a good job, then it's not something we want to waste our time playing around with. There's another treatment, botulinum toxin. Some of you know this by the trade name Botox, but there are actually 4 different products that are all botulinum toxins. They can work also in patients with tremors. Not always, but sometimes they can. They're most often used for head tremors, but they can be used for hand tremors too. And I'm going to come back to this because there's a new clinical trial available for trying this out for people who have hand tremors. Typically, the benefits last for about 2 to 4 months, and the side effects are not so bad. Of course, they're injected into the muscles, which means there's some pain associated with needles, but no more than any usual needle. And since the benefits last for 2 to 4 months, what it means is you can get an injection every 3-ish months or so, and not like every day or every week. Probably the most common side effect is minor bruising or bleeding, because when you put a needle in the body, of course, you get these problems, but it's usually minor, nothing to worry about. Perhaps the most concerning side effect is that when you inject a medication like this to relax the muscles, you can sometimes get excessive muscle relaxation, and that means the muscles may feel weak. Fortunately for us, this is a temporary side effect, so if it happens, it usually wears off after a couple of weeks. So the botulinum toxins are another options for treatment, and I'll come back to that in a moment. I also get this question a lot. What about surgery? What kind of surgery is available? There are 2 main types of surgery that are available for essential tremor, something called focused ultrasound, which uses sound waves to hit brain regions causing tremor. And by hitting these brain regions causing tremor, it basically inactivates them by eliminating them. And if those regions are responsible for causing tremor, then of course the tremor gets better. This is a little bit like how your microwave works. When you put something in the microwave, it uses essentially miniature sound waves to hit the items you put in there, and then they heat up. Okay. Another option is something called deep brain stimulation, which involves putting in a device that looks a little bit like a pacemaker, hooking it up to some wires that go under your skin and go up to the brain. And these wires are often placed into the same region that we target for ultrasound. And this method uses electricity to numb up these brain regions instead of using focused ultrasound to destroy those brain regions. They both work. They've been around for quite a long time, and we know they work pretty well for essential tremor. And there are some side effects based on our experience that we know about. Of course, any surgery can be associated with a problem from the surgical site, like bleeding or infection, which is common for any type of surgery. Some patients who get particularly deep brain stimulation, they complain that their balance got worse after the procedure. Some complain that their speaking gets worse after the procedure. So there are side effects that may occur, but they don't occur in everyone. And so we still use these surgical procedures because they help a lot of people with essential tremor. And usually we don't get these side effects, but it's good to know about them because occasionally they do occur. And when they do occur, we don't like to have people be surprised. What about other things? So I got a lot of questions from the group by email, and this is one of the commonest ones that was in that list of questions. What other things can I do? I get this question a lot in my own patients in my clinic. The most common one is about wine or beer, basically alcohol. And the answer is yes. This can actually suppress your tremor a little bit. But the problem is you can't be drinking all day long. And we don't medically recommend that you use this for your tremors because ultimately it can be habit forming. And then drinking too much alcohol over the years can cause you trouble. So it's not really a good medical treatment. A glass of wine a day or a beer or so once a day for times when you really feel like you need it, maybe in the evening is probably okay. But using this specifically to treat your tremor is probably not a good idea. Some people notice that caffeine makes things worse, and that's a common finding. In fact, any type of stimulant would often make a tremor worse. I get a lot of questions about marijuana or related things like CBD oil. And the bottom line here is that there aren't really any good studies that say these really have a big impact. Many of my patients try them. Some of them feel like they help a little bit, but they're certainly not a solution to the problem. And they usually don't provide more benefits than the other medications we normally use, like primidone or propranolol. I also get this question a lot about diet. Are there things that I should eat to help myself suppress the tremor? And the answer is no. You can eat whatever you like. There doesn't seem to be a big impact of diet on tremor. Now, that's not true for everyone. We know, for example, if you fast too long, if you don't eat for long periods of time, in between meals, the tremor can sometimes get worse during fasting. And that's probably because your blood glucose goes down a little bit. And when it goes down a little bit, then your tremor somehow gets worse. I also get this question a lot. Are there things that I should not eat? The answer is no. You can eat most things that you like to eat. Maybe avoid caffeine and other stimulants. A little bit is okay, but a lot of it can make the tremor work worse. Of course, there may be things that you notice that you eat that cause your tremor to be worse, and that makes sense to avoid those, but they're not like a lot of things globally that we typically say you should or shouldn't eat for essential tremor. Okay, so I got a question about what's new. And this is really perhaps the most exciting part about my presentation for essential tremors, and that we have been dealing with primidone and propranolol for 20 or 30 years now, and nothing new has come along for a very long period of time until very recently. Just in this last year, numerous pharmaceutical companies have announced their interest in developing new medications for essential tremor, and those are listed here. So the name of the medication being tried is shown up here. It's a number. It hasn't been given a proper name yet. It's just a number that comes from the catalog of the company. You see there are 3 drugs listed here at the top. The company that is promoting these drugs are listed here, Jazz, AbbVie, and Sage. This shows the approximate amount of time that is required to participate in a trial involving one of these drugs. And you see they vary a little bit, but not a whole lot. And because we do clinical trials, we have to check you very frequently to see how well the medication is working, and we want to check you frequently for side effects. During these periods, there's a fairly large number of visits. So there are 8 visits here, 12 visits here, and 11 visits here. There are more visits to the doctor because we really want to make sure everything is going well with these new medications. For all of the studies, the companies want people who have tremor that is at least moderate or severe so that they can see an impact of their medication on the tremor. They don't want people with just mild tremor. One of the tricky parts about these studies is that if you're already taking a primidone or propranolol for tremor, you have to actually wean off of these medications. And so if you want to participate in these trials, you have to meet with your doctor or one of the trial doctors, like myself, or one of the trial coordinators whose name is given down here, and they can provide you with instructions for how to wean away your medicine, because we don't like to stop these medicines suddenly. Cold turkey stopping these medications can lead to problems, so they have to be weaned away over a period of a few weeks. For some of these studies, if you've had Botox in the past or any related botulinum toxin, you have to wait a period of 6 to 4 months. And if you've already had tremor surgery, that is surgery specifically for your tremor, like focused ultrasound or deep brain stimulation, then you can't participate in these trials, because they want people in the trials who haven't already had a major a procedure that might change their tremor. All right. Now, during my presentation, I tried to answer some of the questions that I got by the email. Of course, I can't answer all the questions I got because there were quite a few of them, and we would be here all day. So some of them have been addressed already. Some of the questions I got were a little bit personal, specific questions about personal treatments and devices and things that one person should or shouldn't do based on their specific experience. And I usually don't like to answer these kinds of questions in a public way, because I'm not supposed to be giving personal, specific medical advice to one person at a time without really having met them, particularly if I'm just giving a lecture on the internet. However, I can address common questions that are of more broad relevance. And if you want your more specific questions answered, I would have to meet with you individually. So here are some of the other questions that we saw about tremor, and they may apply to many people. One of them is this: I have balance problems and I fall a lot. Is this essential tremor? And the answer is yes and no. It's not essential tremor, but we actually know that balance problems are part of essential tremor after many years. Many people describe a balance problems, and occasionally it gets bad enough that people fall. So yes, these balance problems may not be something new, but they may be part of the essential tremor spectrum getting worse over the time. It's not a tremor that leads you to fall. It's just balance problems. Why this happens, we don't really know, but we do know that it does occur, and it's not some new or independent problem. There are sometimes questions about exercise in tremor. Some people say that exercise makes tremors worse. And what can I do if I want to continue to exercise? And there's a couple things you can do. Many people exercise without getting their tremors worse, and so we're not really sure why some people have this problem, but you can occasionally try less vigorous workouts. For example, walking is an exercise that most people can do without worsening their tremors. Swimming is also another good one. But very, very vigorous exercise, for example, lots of weightlifting or extensive aerobics, those can make people have their tremors get worse. And we think it might be related to the fact that your blood glucose goes down when you exercise a lot. When you're exercising, your muscles begin to use up your glucose in your bloodstream. And if your body can't replace it fast enough, your glucose goes down. And sometimes this makes a tremor worse. So you can occasionally try to eat something or try to take something with a little bit of sugar in it before you exercise, like orange juice, and see if that will help you. Doesn't always work, but occasionally it works a little bit. And then finally, what else can I do? And I would say one of the biggest things you can do is join the effort to find better treatments. This could mean participating in a clinical trial, like some of those that I listed for you earlier. It could mean participating in brain research that helps us understand better what's going on in the brain that might be causing tremors, and a whole variety of other things. So if you're interested in this, then I would encourage you to contact our study coordinator, Cameron Yao, and I'll bring her email back in a moment, so that you can write it down and contact her if you want to participate in any of these studies. So I believe that is my last slide, and I'm going to go back to this one. because this is the one that lists the ongoing tremor treatment clinical trials that we're doing. These have already been started, and the person involved in organizing these for us here at Emory is Cameron. So you can write down her email. If you don't have a pen at the moment, you can always send a message to me or to Cornelia of the outreach program, and we can get you in contact with the right people. So with that, I'd like to end the presentation and thank all of you for attending. We hope you the best of luck and wish you the best of success with whatever treatment you're using, and hope to see you if you're interested in participating in the fight to find something better. Thank you very much.